Among all the news we all have been getting about corona, it actually is difficult to differentiate fake ones from the factual ones. I thought it is wise to give an episode of the actual situation. All the information that I am going to give now are taken from properly researched authorized sources. So this is going to be a very short episode containing the true facts about the COVID-19. So the first one is a study conducted by Imperial College London. The study says that if you don't interfere with the spread of the virus or intervene to slow the spread of the virus, 80% of US population will get infected and 0.9% would die. That is roughly 2.2 million people. Other way of looking at it is 4 to 8% of all Americans above 70 years of age will die, which means the need for ventilators will be 30 times the available ventilators in America. We talk about America here because the study was about the US. We can't think that this fact is irrelevant to India. If the same fact is applied to India, more than 80% of the population will get infected because we live in a more unhygienic and close quarter society when compared to the US. According to this study, if the virus is not contained, 9 crore people will die worldwide. This is 15 times the death toll of the Holocaust. Is the world ready to face such a huge loss? No. So what do we do here? Well, our government seemed to be taking care of that well. Quarantine is the best answer. If one person from a family is infected, the whole family should be quarantined, including the neighbors. All public places should be kept shut. Just like in Italy, France and Spain, strict lockdown should be followed in the very early days of the threat. Then the death toll might decrease. As the number of infected cases go down, the number of death toll might also decrease. The reason that US and UK have taken the COVID-19 seriously is because the virus has actually raised the concern levels globally. Mortality is linked to pressures on healthcare demand. If healthcare collapses because of sudden peak in demand, then the death toll will also increase. There is another study that says there is significant correlation between the weather conditions and the spread of the virus. Based on research from Portugal, Spain, Finland and China, the virus cannot spread in extremely hot and cold conditions. Another study from Beijing recorded the rate of spreading of the virus in various temperatures and humidity. The study was actually done in 100 different cities in China. According to these studies, with every degree Celsius rise in temperatures, the spread of the virus is brought down by 0.0383%. Further, each percentage rise in humidity brings it down by 0.0224%. That also reflects in the pattern we see globally. If we observe something, countries that are closer to the equator have seen less spread of the virus. Countries like Indonesia, Philippines, Thailand have much more contact with China, but the number of coronavirus cases recorded in these places are very less in comparison. So, there is a link with the temperature and the spread of virus. This seems optimistic, but we see that Iran has many cases of corona infection and that is a hot country too. If we look at the map of that region, we will see that Iran is a country on a high plateau, closer to the north, and its weather pattern in winter is much more like the weather in Europe. That could possibly be the reason that Iran has more cases of the infected. But all these are right now non-peer-reviewed studies. Now, let's see about the medicines that could be used for COVID-19. There is a drug called favipiravir that works against RNA viruses and was used against influenza in 2014. Chinese authorities have also cleared that those drugs could be used for COVID-19 infected patients. A Shenzhen study also says that favipiravir is effective against the COVID-19. Wuhan University study also backs the usage of favipiravir for coronavirus. Chinese Science and Technology Minister also agrees with this study. There was another research published by Elon Musk. The Tesla fame Elon Musk himself said that drugs used for malaria is also effective on this coronavirus. In fact, this is the drug that the doctors are using everywhere on COVID-19 patients. Another drug named remdesivir is also found to be of some effect. These are the big developments and scientific updates on corona as of now. Stay tuned with us for any updates on corona. Keep supporting this outdoor woman, Nisha PS.